I'm someone who had constant pain in my lower back, in my hip joints, down one leg, sometimes both legs, in my neck. And I recovered from that constant excruciating pain using a method called ABM neuromovement. And because of that, now I have worked for over 20 years with other people to overcome any kind of pain they have, whether it's constant like mine or pain that comes and goes. Do you have either constant pain or a pain that comes and goes? If you do, did you know that 66% of chronic pain is reversible? 66%. The part that's not reversible are people who have from some kind of an illness that's causing it. And sometimes that can actually get better, but an illness, or if you're totally missing cartilage or a disc. The disc is totally disintegrated. What most people and where most people think the problem is, and this might surprise you, is not where the problem actually is. It's actually somewhere else. When I was in constant pain, I used to think that if I just did more exercises and got stronger, if I just stretched more and got more flexible, if I did more exercises that the physical therapist recommended, if I went to the chiropractor more and got my spine perfectly aligned and didn't mess that up, that the pain would go away. But I found that it didn't change anything for me. Maybe you tried some of these things, and yet you're still managing the pain. You might have a little bit more capacity to do more things, but your brain has not changed the way you organize movement, the way you know how to move. You have the same patterns, the same habits, so you're just recreating the same problem. It was only when I let myself learn something new that everything shifted. And I was able to not be stuck in those same movement patterns. And I created new movement patterns. Now, I'm really curious about you. I'm curious about having you do a movement to give us an idea of how to shift it if we can shift it. You don't have to have pain in this area. Just raise your arm to the ceiling, and then lower it back down. Great. Now, keep your arm down. What did you notice about lifting your arm? Most people don't notice anything. They accept the arm went up and came down. And that's very typical because your brain was in automatic mode. Automatic mode. You were doing the habit of what you know of lifting the arm. Very important to be able to do. But if you want to shift the pattern, if you want to change the way you know how to move, if you want to get out of chronic pain, you need your brain to be in learning mode. So now I'm going to have you do the movement in learning mode. So I'm going to have you do the movement very slowly. And as you lift the arm, start to feel. Do you feel movement anywhere else besides in the arm? Maybe you notice the shoulder joint. What about your shoulder blade? Do you feel any movement in your shoulder blade? Do you feel it gliding along the back of your ribs? It may or may not be. What about your back? Does your back change shape? And also notice as you lower your arm, does your back change shape in any way? Do you at a certain moment arch more or round more or get longer on one side? What is it you feel and notice? If you're sitting, notice your tush on the seat. Do you shift a little bit your weight? Does your pelvis tilt a little? Now keep your arm down. That's excellent. Whatever you notice is fine. Now most people, when I ask them to lift their arm, they will lift their arm like this. They'll use this muscle, the trapezius muscle, to lift the arm. So the shoulder gets closer to the ear. This causes a lot of tension, not only in the top shoulder muscle here, but in the neck and also in the back. I had a painter who came to me, painted walls, and he actually had this very thing going on, and it was repetitive, so he spent a long time with a lot of pain. And after a series of sessions, he was able to learn these new patterns, and I'm going to show you in a moment, that completely shifted it, so he actually stopped having pain. If I lift the arm, and I use this shoulder to lift it, I really only have this much movement in my shoulder joint. Anything past this, I could force it, but anything past that, and I will be straining in my shoulder joint. But instead, if I lift my arm using the relationships of my arm to my back, I will be able to lift my arm all the way to here without any wear and tear in the shoulder joint. I feel no tightness, I feel no heaviness in the joint. It's a lightness and ease to it. So again, I know what the relationships are, what the arm has to do with the center of my body moving. If I do it the other way, where I just use this top muscle here, you'll see I do not move the center of my body in a way that makes sense. And I've already now overstrained. I've already strained the shoulder joint. Here is about before I strain, just to there. And this is true of knowing these relationships, and they're different if I want to raise the arm compared to if I want to reach across the body. If I want to raise the arm, I need to arch my back. I need to allow the chest to move up. I need to allow the pelvis to tilt forward. I need to allow the shoulder blade to glide along the back of the ribs. If I want to reach across, then it's different. I want to use the abdominal muscles. I want to allow the chest to slide. I want to allow the shoulder blade to move in a different direction. And it's different if I want to reach behind me, what movement patterns I need. So it's knowing these, what we call dynamic relationships. Dynamic meaning it's in movement, it's in action, whatever direction we want to do it, however we want to move. This is also true for other things that you want to do, whether you have pain in the knee joint, the hip joint, the back. And it's different for everything. Going upstairs, picking up a child, how you would use yourself best. A woman called me named Joanne, and she had terrible knee pain. And she had knee pain so badly that she could no longer go up the stairs to sleep in her bedroom with her husband. She was sleeping on the couch. This was for 1 year. They were world travelers and retired. They couldn't travel because of her knee pain. I watched her come up the stairs. At the time, I had 3 stairs up into my office. I watched her come up the stairs, leaning all her body weight onto her husband, limping up the stairs. Her knee was swollen huge. She'd been doing exercises she had been given. She was doing them twice a day. She was going to PT twice a week. And still, she was still having the same problem. I saw what movement patterns were missing. I could see that. And I started helping her establish those dynamic relationships so that she had very different movement patterns. On the 10th session, I hear her husband calling behind her, saying, "Joanne, Joanne." And she said, "Yeah." And he said, "You came in the office." And she said, "Yeah, I know, I have an appointment." He said, "No, you went up the stairs without me. In fact, you ran up the stairs." And her swelling had gone down in her knee, and she said, "I know, my knee just feels fine. I don't even notice. I don't even remember. I didn't even think about my knee." So I want you for a moment to imagine what it would be like to live without that pain, to be able to do the things you want to do, the things you love. I want you to imagine that's your new normal. If you'd like to overcome chronic pain, and you want to reach out to me, I can help you do that.